Hi everyone, welcome back to Little Growing Bones. So today we'll be talking about a rare but important condition. It's called Tibia Hemimelia. So it may sound very complex, but that's why we're here today, to break it down for you to understand it better. So we'll cover the causes, the symptoms, how it is diagnosed, the treatment, and the treatment options and the potential complications as a result of this condition. So let's get started. So what is Tibia Hemimelia? Tibia Hemimelia is a rare condition where the tibia or the shin bone is underdeveloped or missing entirely. So the tibia is one of the two bones in the lower leg, the other being the fibula. When the tibia doesn't form properly, it can lead to significant issues with limb-leg discrepancy, alignment, and the overall function of the leg. So this condition can occur in one or both legs, and often the prevalence we have at the moment is 1 in about 1 million, so it's very rare. Despite its rarity, advances in medical treatment have been given to patients to better the outcome than was the case before. People who have made so much advance in the care of Tibia Hemimelia include people like Paley. There's lots of research that has been done around the treatment of this condition. It's a tough one to treat, as we shall discuss in a few minutes to come. So now let's talk about the causes of Tibia Hemimelia. So the exact cause of Tibia Hemimelia isn't always clear, but often it's linked to genetic mutations or disruptions during fetal development. Some cases are associated with genetic syndromes, while others happen spontaneously without a family history or anything like that. So it's important to note that this condition is not caused by anything the parent did or didn't do during the pregnancy. So now let's talk about the symptoms of Tibia Hemimelia. How can you recognize Tibia Hemimelia? So here are a few key symptoms. One, and most commonly, is a leg length discrepancy. So there's normally, the affected leg is normally significantly shorter than the one that isn't affected. There's always deformity. The deformity may be in the leg or the foot. There's often joint deformities. The knee and the ankle may be misaligned or have limited range of motion. Often there is instability. The leg may lack proper support for standing or walking. And just like we talked about in the definition, often there is an absent or underdeveloped tibia. This is often seen on imaging studies. Another feature that we see is soft tissue changes. So these may comprise underdeveloped muscles or abnormal positioning of the foot. Okay. Another feature that is commonly associated with Tibia Hemimelia is extra toes or polydactyly. So polydactyly is where someone has more digits than they should have. Commonly in Tibia Hemimelia, they have more than 5 toes on that affected foot. Sometimes that's the only symptom that reminds the doctor that there is something wrong with the leg. So we created a video on polydactyly a while back, and I'll just link it up here for you to review. So symptoms are usually noticeable at birth or very early on in the child's life, right? So how do we diagnose Tibia Hemimelia? So diagnosis of Tibia Hemimelia involves a combination of clinical exams and clinical exam and imaging studies. So doctors will look at the child's medical history, perform a physical examination, do x-rays, do MRIs, do CT scans, whatever is needed to help and visualize the bone and assess the severity of the condition. So sometimes genetic testing may be recommended to check if there's associated syndromes, but this is quite rare. Okay, so just like many medical conditions, early diagnosis is crucial for this one as well, because it allows for timely planning, which can help improve outcomes in the end. Now, how do we treat Tibia Hemimelia? So let's talk about the treatment. So managing the Tibia Hemimelia often requires a personalized approach. And even though normally it's the leg that is involved, it's important to exclude any other conditions that could be present. So this is one of those conditions that might require multidisciplinary approach, involving the pediatrician, the geneticists, the orthopedic surgeons, involving the physiotherapists, the orthotists, and very many more. So, but that aside, let's talk about treatment specifically for Tibia Hemimelia. One of the options available is the use of orthotics. So braces or splints can provide support for milder cases. Another treatment that is recommended and is often the mainstay of treatment for Tibia Hemimelia is surgery. One option for surgery is reconstructive surgery, and the goals around reconstructive surgery normally are to lengthen the leg and stabilize the leg, and to correct any deformity that is present in the leg. The other option is amputation and use of prosthetics. So in very severe cases, this may provide the best functional outcome for these children. And after the amputation is done, then the child is fitted with the prosthesis. Like I mentioned, it's one of those conditions that requires multidisciplinary care, so physical therapy is very important. It's essential to build and strengthen the muscles, improve the balance, and help them during the walking process. So the choice of treatment is basically dependent on the severity of the condition and the child's specific needs. And before we close off, let's talk about the potential complications of this condition. So without treatment, Tibia Hemimelia can lead to, one is severe mobility issues. It could be very difficult for the child to walk. And another is just complications in unrelated joints, things like onset of arthritis or any other additional deformity. But like we mentioned earlier, early intervention and the proper care for many children go on to lead them to having an active, fulfilling life. Right? So this is a rare condition, but treatment options are available. As we wrap up, I want to emphasize the importance of a supportive care team for these children, which might include a pediatrician, orthopedic surgeon, physical therapist, prosthetics specialists, very many specialists. And but with the right plan in place, these children can have incredible outcomes. All right. So when this is seen, please go see your doctor as soon as possible, and then let the right plan be drawn out to maximize the outcome for these children. And until next time, don't forget to share, subscribe, and give us a thumbs up, and keep it on Little Green Bones.